Hello, I'm Bob Chaloner, the Chief Administrative Officer at Stony Brook Southampton Hospital, and I'd like to welcome you to another edition of Focus on Stony Brook Southampton Hospital, your monthly television program about the events, the people, and the services at your community hospital. It's the start of the summer season here in the Hamptons, and with the summer season, one of the guests that we've welcomed into our communities, I guess I should say we haven't really welcomed them, but have arrived in our community. We notice them more in the summer are ticks, and today we're going to talk about ticks and tick-borne diseases, and I'm very fortunate to have with me Rebecca Young, who is a registered nurse. Rebecca has been working with our regional Tick-Borne Disease Resource Center for a number of years, and she's going to talk with us about ticks and tick-borne diseases. Rebecca regularly educates the public on the subject and also answers all of the calls that are made to our tick helpline. Welcome, Rebecca. Thank you very much for being here.
Thank you for having me.
Yeah, my pleasure. And also thank you for all the good work that you're doing with the Regional Tick Center.
My pleasure.
You've been involved with it for a couple of years,
yeah.
I know. I always like to learn a little bit about people. I know you live out in this area.
Yeah.
I run into you periodically in the community, but tell me a little bit about yours.
Yeah.
Before we talk ticks, tell me a little bit about Rebecca
A little
first
bit.
and how you ended up out here.
Originally, I'm from Pennsylvania, outside Philadelphia, and I learned about ticks in my hometown, which in the 80s was one of the most infected counties in the Northeast.
Really?
Interestingly.
In Pennsylvania, yeah.
Yeah. And from there, I went to New York City and worked in a private school for a while, and constant kids coming in from their vacation homes in the Hamptons and from New York or New Jersey with ticks that I would take off. And they also, from the summer, would come in with aches and pains. And at that point, we were trying to decide how do we sift Lyme disease out from the growing pains that so many of these kids have, which we had a lot of conversations with sports medicine doctors and pediatric orthopedists about testing for Lyme.
Right.
And I was also working as a medical director at a camp out here in the Hamptons. Again, lots of ticks, lots of rashes, and then I moved out here year-round a couple of years ago, 3 or 4 years ago, and I saw that Southampton Hospital was on the verge of opening a tick resource center. And so I was interested, so I came to one of your wonderful, you had a panel of doctors speaking right here, actually. Right. And I became interested, and that's where I met Karen Wolfrat, the Administrative Director,
right.
and
that's right.
Debbie Maley, the Director of Infection Control, and I've been here since.
And we certainly welcome you because you have you've been taking really a big role in terms of helping people understand the role of, or helping people understand tick-borne diseases, questions, doing teaching now yourself on our behalf. But maybe we should just back up a little bit and just talk about our Regional Tick-Borne Disease Resource Center also. Can you tell us a little bit about that and what we do?
We are a resource for both the medical and the public communities by way of educational symposia, presentations. We're part of the Tick Advisory Panel of Suffolk County. Right. We have a medical and scientific panel that advises us, advisory. And we also maintain a dedicated helpline. It's like a hotline, but right. You know, we call it a helpline. And I get a lot of different callers, and I had about 900 calls last year.
900.
900.
Wow, that's. Can you tell me a little bit about those calls? What kind of calls are you getting?
Well, I can get calls anywhere from I have a tick on me. What do I do? Very upset, anxious. Right. To calls that might be somebody that says I've been sick for 10 years. I've seen several doctors, I've tried everything, and I just can't get well, and I have a positive Lyme test.
Right.
So that range, plus, of course, how to treat your property, what are the ticks doing, which ones are out there, what can I do to keep myself safe, all that kind of. Lots of very interesting conversations.
I bet you do. I've heard you've had questions from as far away as Australia, even, that people have heard about our helpline and called you from other parts of the world, actually, so.
Yeah, I have had from different countries, some. I've had mostly from Europe and England, a little bit, Australia, one from Japan. I get them from across the country, a lot from our area, but a lot of doctors call me from Manhattan. I think that doctors who are not in our area are
Right.
trying to educate themselves
Yeah, I know
with
that.
what's happening with Lyme disease, keep up with, the vaccines and the new tests.
Our doctors certainly see a lot of tick-borne illnesses, and we hear about Lyme disease, but there are multiple, as I know you'll talk about. But I know that our doctors, our medical staff's becoming a referral source for folks also, just that have questions on how to deal with these. So let's talk a little bit about ticks. And I know I live in the northwest woods of East Hampton. It's a woody area. I was out running actually this morning with my dog, and when I got home, I probably pulled about 6 ticks off my dog, and they don't all look alike. What are the ticks that, there's multiple species of ticks, right? What are the
Right.
ticks that we're seeing out here?
We have 3 ticks that we need to pay attention to out here. The first one, the deer tick, which most people are familiar with because that is the tick that gives you Lyme disease.
Right, that's the one we hear about all the time,
Right.
right? All right.
We have a newcomer, the Lone Star tick from the south, and as it turns out, we now have more of those in our area than we do deer ticks.
Do we really?
Yeah. In fact, it's the male and female right now today that are in the big numbers out
Okay.
right now. As we shift into the summer, we get into the nymphal ticks of the deer tick, and it switches, but right now, that's what you'll see.
So probably today. I noticed that my dog, a couple of them I pulled off, had the little white dot in the back of them. That's the Lone Star
A
tick, right?
definitive diagnosis
Okay.
of a Lone Star tick.
Okay.
We're fortunate to have that because we can distinguish it from the deer tick, so then we know that we won't get Lyme disease from that tick with the dot on it.
Okay.
But the male doesn't have the dot, and it could be confused
Oh, really?
with the other ticks.
Could be confused with a deer tick, so.
Could be, or a dog tick. Dog
Okay.
ticks are the third category. We used to see them a lot more as children, but they're not as prevalent
Okay.
anymore. Mostly it's the deer tick and the Lone Star ticks.
Okay. I remember when I was a kid, there were the big gray ticks. Was that a dog tick,
Yeah,
probably?
yeah.
Okay, the big, puffy gray ticks that were. So, one of the things, and I've heard this at some of our symposia, and I know myself I often wonder about, is I grew up in upstate New York, which was also a pretty woody, natural area. I don't think I ever saw a tick. It wasn't until I moved out here to the east end of Long Island that I even saw ticks. And it just seems like there's a lot of them. What's going on? Are there environmental issues,
There
I should
are.
say?
Global warming, or the warming, has caused ticks to not die off quite as easily. There's habitat disruption, which has been happening on Long Island forever with the farming, and what that's done is gotten rid of a lot of our mid-size animals.
Okay.
And that's important because the mid-size animals prey on the small animals, and it's the small animals, in particular the white-footed mouse, that gives the tick the disease that causes Lyme and the bacteria for other diseases as well. So there are also bumper crops of acorns. So here with these small animals that give the disease, they've got unlimited food and no predators. We have a few scraggly foxes around, but they're not really
Right.
up to the job. We've
Right.
lost our bobcats, our rattlesnakes, for instance. Last
Right.
one in Long Island was in 1960.
Is that true? Wow, I didn't even know there ever
Yeah,
were
and
rattlesnakes.
lynx
Yeah.
and cougars, and they all took care of these small animals. So
Okay.
now they're just in huge abundance, and
Right.
that's one of the problems. The Lone Star tick came from the south. They have increased our tick population by there's twice as many of them. So they came on birds.
They did.
That's
okay.
the theory. We don't
Okay.
know for sure, but
Yeah, I always
and they are
wonder how do
spreading.
they travel? I mean, they certainly don't see them driving in cars or anything. So birds, even some of the islands, I know Nantucket, Martha's Vineyard have tick issues. It must be birds that are carrying them out there as well.
And
so.
Central Park in Manhattan.
Really?
Birds.
Really?
taking it.
Interesting. Yeah, how they make their way across Midtown Manhattan would be a challenge.
I don't know if they do that.
Yeah, no. So I guess that makes a lot of sense. I mean, and plus we're living in wooded areas, and we tend to, certainly one of the things we enjoy about here is being so close to
Yeah.
nature, and my house is right in the middle of the woods, and lots of oak trees, lots of acorns. I see small mice and voles all over the place.
Yeah.
That must be why I see so many ticks around where I live. So.
Exactly, and also because we've got a prevalence of deer here, and the
Right.
deer are a transportation. They are a host, which is different than a reservoir. The small animals are a reservoir. They hold the bacteria of the ticks. The deer are transportation, and the ticks mate on them. So the deer carry them all over the place. And there's so many deer now, so they all contribute.
Nymphal ticks are getting the bacteria from the mice and eventually ending up on deer, and it's the deer that are
travel them around.
The supersonic highway transporting them all over the place.
It's actually the larval ticks that feed on the small animal, then they molt into a nymph. And it's the nymph tick that is very dangerous, the deer tick. The nymph tick of the deer tick is very dangerous because they have the bacteria in them, the spirochete, and they're about the size of a poppy seed, and so it's easy to miss them.
Right.
You could have a couple bites and not realize you had them. The adult deer ticks you'd see a little bit more readily. So that's the problem.
Okay, so maybe more likely to pull them off, and we'll get to that, I think, on how to remove a tick and time frames. Let's talk a little bit. I know that you mentioned that deer ticks are the ticks that carry Lyme disease. The other ticks don't carry Lyme disease, and do they carry any other diseases?
As far as we know right now, the other ticks are not what they call vector competent to transmit Lyme disease. We hope it stays that way.
Right.
Right now, the deer tick gives you obviously Lyme, babesiosis, and anaplasmosis, and miyamotoi. Those are the main ones, and we test for those on a panel when you go get a tick test. The Lone Star tick, the main disease that we're a little concerned with is ehrlichiosis. 1 to 2 weeks, you can get very, very sick, easily treated with doxycycline.
Right.
The other problem with the Lone Star tick is that it can sensitize you to red meat.
Okay.
The meat of animals with hooves.
Right. Okay.
Non-mammalian.
Right.
And you could get a very dangerous allergic reaction, end up in the hospital, and that's from the Lone Star tick. They can also give you Rocky Mountain spotted fever, but we see so few cases of that here that we don't regularly test for it.
Okay. What about dog ticks? Do they?
And dog ticks also can give you Rocky Mountain spotted fever.
Okay.
But like I said, we hardly ever see it. We know that there are some what we thought were false positives, but that's because there may be another strain of Rocky Mountain spotted fever that may be out there that makes you not quite so sick.
Right.
With Rocky Mountain spotted fever, you get very, very sick. And the good news is that disease plus all the others, with the exception of one, are treated with doxycycline.
Okay.
So if you're misdiagnosed and it's a different tick disease, it'll still be taken care of, with doxycycline.
What's the one that's not?
Babesiosis.
Okay.
That's a big problem,
Right.
carried by the deer tick. What we know now is that 40%, as much as 40% of people with Lyme have babesiosis.
Oh, really?
So if you come in with an EM rash, the rash of Lyme disease, and you you have Lyme disease, here's your medicine.
Right.
And then you're still sick. It's possible that you had babesiosis too. The problem is that babesiosis takes a different medication.
Okay.
It's like they used to call it Montauk malaria or island fever.
Okay.
And it takes a quinine type medicine called Mepron or atovaquone together with azithromycin.
Quinine's what we give for malaria, right?
That's right.
Yeah,
So
okay.
now they give Mepron.
Interesting.
Yeah.
So let's talk a little bit about Lyme disease. That's the one that we hear about. I would like to explore some of the other ones, but Lyme disease is clearly the one that we all are very, very worried about. And can you just talk a little bit about Lyme disease and some of the signs and symptoms?
Lyme disease is very easily treated in the first stage, which is like the first month. And that's a time when you might feel like you have flu, headache, not feeling well, just sort of general malaise. And the problem with that is some people, if you get a flu in the summer, that's a little odd.
Right.
So that might be a red flag.
Right. I've heard that said. If you're feeling achy and feverish in the summer, you probably may want to think about it, especially living out here.
So you might not go to the doctor.
Right, right.
So you might wait till you get into the next stage of disease, which then you get like neuro symptoms such as a very common was Bell's palsy, only it's really a Lyme palsy. Also, treated with doxycycline.
What is Bell's palsy or
it's
Lyme
the seventh
palsy?
cranial nerve is affected.
Right.
And it happens to be one of the neuro results of Lyme when it gets into the nervous system.
I see.
And there are even cardiac issues in the second phase. And then you
Okay.
get some arthritis issues, which you've probably, your Montauk knee, for
Okay,
instance.
right, the achy
second
knee or
stage
the swollen
Lyme
knee,
disease.
right, okay.
Swollen knees, usually it's unilateral, one knee. And then when you go beyond that, you can just get more sick with those. You could get third-degree heart block, you can have cognitive fog, you can have crippling arthritis.
Okay,
And all of it treated with doxycycline. However, if you get into a later stage, you might be given IV antibiotics.
well, that was going to be my question. How do we treat Lyme disease? So you're anticipating me very well. It's like, all right, I've got it. What do I do about it now? Exactly. So, but it sounds like the antibiotics. We hear a lot about antibiotics losing their effectiveness. We're not seeing that so much with Lyme disease. The antibiotics still work against.
Not with doxycycline
Right.
so far. That's such a good point.
Right.
We try out here. We try not to. The doctors try very hard, do a very good job trying to sift out who should take doxycycline
Right.
and who shouldn't. Some people stockpile it, and every
Right.
time they go for a walk and see a tick, they just take some doxycycline. And the doctors here really want to wait until they see some kind of symptom.
Right.
And then much later on, you can have an antibody test. The diagnosis of Lyme is a combination of the test and the clinical picture.
Okay.
And people are a little too eager out here to take antibiotics. And since you can be bitten by a tick every day out here, conceivably you could be on doxycycline all year round.
Right.
So the doctors are doing a really good job out here. I think people try to jump the gun sometimes.
Yeah.
But so far, doxycycline is still good. If doctors feel that that's not working, they do have cocktails of different antibiotics, or if they feel like it's very much in the nervous system, they might give you an IV.
Okay.
Rocephin is usually the drug that they give, in which case you have to see a neurologist.
When would you recommend somebody go see a doctor? They've been bitten, or they've got that fever, the achiness in the middle of the summer. Do you think that's sufficient to go
Yeah,
get tested?
I do.
Yeah.
I think you should go to a doctor,
Right.
especially if you have a history of a tick. If you have a
Okay.
tick and you've pulled it off and it's
Right.
been on you for a while,
Right.
and you are feeling, after a couple weeks, you're feeling not so good, not yourself, you can be a good judge of that. Absolutely go to the doctor.
Right.
There's also a prophylactic dose of doxycycline. We're not sure how well it works.
Right.
It's just one dose. Many doctors give it, and that's something you could do upon 72 hours after you pull the tick out.
Okay.
But beyond that, the doctors here will ask you to wait for signs and symptoms, and then you can get an antibody test after
Okay.
4 weeks or so.
Okay. Yeah, I know. If you take the test right away, it doesn't necessarily.
You won't have
show
the antibodies.
anything.
You'll get a
Right.
false negative.
Takes
yeah.
a little while. Okay. So you would recommend, if you've got those symptoms, especially if you've been exposed to a tick, it's probably a good idea to go get checked. And the test is a blood test, right?
Right.
A little bit of a prick, but nothing, we're not going to subject you to x-rays or all of those things, right? So, so let's talk, one of the things you mentioned that I think is fascinating is the idea of co-infection and some of these other diseases. It is possible to carry several at the same time? Right.
Absolutely. I've seen tests come across my desk where three.
Really?
A person has three. They're called co-infections. They are acquired at the same time.
Right.
And usually it's from the deer tick because they carry babesiosis, Lyme, anaplasmosis, and miyamotoi. The Lone Star tick carries ehrlichiosis. And we have
Not the other diseases? Or
No.
They don't think so? Yeah.
We have seen Lyme and ehrlichiosis together. That would suggest that you had a bite from both ticks.
Oh, really?
Yeah.
Interesting.
But the main one we're concerned with, the co-infection we're concerned with, is babesiosis and Lyme.
And what is babesiosis exactly? So,
Babesiosis is actually a parasite. It's
Okay.
like malaria.
all right.
And it invades the red blood cells.
Okay.
And so when you have babesiosis, you will have chills, temperature, sweats, and anemia.
All right.
The interesting thing about babesia, though, is that some people don't express symptoms. They don't feel it. They don't know they have it. And other people are so sick that they come close to death.
Really?
It's really interesting. And that's why babesia is a problem in the blood supply, because
Okay.
so many people might have their blood drawn and they don't know they have babesia. And
Oh,
we're only
interesting.
starting to test for babesia in the blood
Have there
supply.
been cases of Babesia being transmitted through donor blood?
Supposedly,
Yeah.
yeah.
Okay.
I mean, they don't know for sure, but yeah.
Will it go away by itself eventually if you don't feel any symptoms, or ultimately?
Well, that's a really good question.
Yeah.
It is thought if you have a low enough level of babesia in your body, that your body will take care of it.
Okay.
You know, that your body can take care of it. And then when you cross over a certain line, you need help.
Okay.
You know,
Is it fatal? I mean, if
it
you've
can
got-
be.
So
It
it's
can
not
be. We've had
something-
cases that have been fatal.
So it's not something to fool around with either. So, and how's that treated?
How's that what?
How's it treated? Babesiosis.
Babesia is treated, as I was saying, is treated with different medication. That's what's, as I said it before, and it's just so important to remember, a
Right.
different medication than Lyme and the others. And it is a quinine-like type drug called Mepron, and the other name for it is atovaquone, and it is given together with azithromycin for 11 days usually.
Okay. And you can do both together if you've
Yeah.
got
Yes, you can.
suspected Lyme and the other. You can do all those medications together. So, you mentioned a couple other diseases. Ehrlichiosis, what is that?
Ehrlichiosis is a bacterial infection that comes from the Lone Star tick.
Okay.
And you get sick in 1 to 2 weeks. And the good thing about it, might not sound good, but the good thing about it is you get suddenly very, very sick. I've had patients that can't even lift their heads because their neck is so sore. They feel like a truck hit them.
Wow.
And it's the same thing as with many tick diseases, headache, feeling awful. You know without question that you have to go to the doctor.
Okay.
And then you should go right away. And they'll put you on doxycycline, and that treats it very well.
Does it?
And you don't need as long a course of
Okay.
doxycycline as Lyme.
With that?
Yeah. But
And
there's prevalent, and
Oh,
dogs get it too.
dogs
so watch
do
out.
get it. Okay. Dogs get Lyme disease too, I've been told by my vet. Is that
Dogs
true?
get Lyme
Okay,
disease.
yeah,
Interestingly, dogs get it,
Yeah.
and horses get it, but cats don't get it,
Cats
and deer
don't.
don't get it.
Oh, wow.
And they think that's something to do with the complement of the immune system.
Whatever's in their systems, right? What about, you mentioned Miyamoto and anaplasmosis?
Anaplasmosis, anaplasmosis used to be associated with ehrlichiosis because they're very similar. But they have determined that they are two separate diseases, and they're almost identical in their clinical picture. It takes 1 to 2 weeks to come down with symptoms. It can be a very dangerous disease too. You get sick, very sick quickly. The difference is that anaplasmosis is carried by the deer tick,
Okay.
and ehrlichiosis is carried by the Lone Star tick. And
see.
anaplasmosis, dogs can get that too.
I can, okay. Boy. And the last one you mentioned, Miyamoto, is that?
Miyamoto, yeah,
Miyamoto,
that's kind of a
okay.
newcomer on the block.
All right.
We have only recently started testing for it. It's
Right.
another Borrelia, so it's very close to the Borrelia burgdorferi, which is the Lyme disease species. Treated the same way as Lyme, has similar symptoms to Lyme. So it would be hard to tell the difference, but if you had a negative Lyme, you might think Miyamoto.
Okay.
So they usually test for all of those.
And one other thing you mentioned, and then I want to get away from the diseases and how do we take care of ticks, but Alphagal and the meat allergy, and I know Dr. Aaron McGinty is one of our allergists out here, has done quite a bit of work on that. And actually, I know we have a CTV episode that people can find on our website about it. But can you just talk briefly about Alphagal meat allergy?
Yeah,
And
she's
what
terrific.
that
Dr.
seems to be
McGinty
about?
is
Yeah.
terrific. I refer so many of my patients and callers
Right.
to her. She knows a lot. Alphagal is the Lone Star tick, including the larval ticks. That's really important because larval ticks are sterile. They don't get any disease until they feed on a small animal.
Okay.
But this is an allergy. It's not a sickness. It's part of the makeup
Okay.
of the tick. So even as a larval tick, and people get hundreds of larval tick bites at once from the Lone Star tick,
Right.
usually in the fall. And they can give you this allergy. They can sensitize you to these red meat, to the non-mammalian
So
mammals.
something in the tick
It's a
saliva
carbohydrate.
or something,
It's
whatever?
a carbohydrate,
Okay,
and, yeah, and they
All right.
inject it into your blood. And then when
Okay.
you eat meat, you have all these antibodies to it.
Right.
React to it. And the reaction, interestingly, is 3 to 6 hours after you eat the meat. That's different than like a peanut allergy where you eat it, immediately you have a reaction. So that's the delayed reaction is what has been a surprise to some medical professionals. But they're pretty, especially the doctors out here, are ready for it, you know.
Okay, great. Well, thank you for that. So let's talk, in the few minutes we have left, what do you do when you have a tick on you? How should you react? What should you do? And what's the proper way to remove a tick?
I think the most important thing, first off, is to get the tick off you.
Right.
Because the longer it's on you, the more likely it's going to transmit disease to you.
Okay.
I mean, I had a patient that waited 24 hours so that they could have the professional in the ER take the tick out
Right.
in the proper way.
Right.
But that was a really dangerous thing to do because now that patient is at risk for getting the disease, whereas if they had taken it off any way they could, initially they would be much less likely to get the disease.
It really doesn't require an ER visit to remove a tick. We can all learn to take
Yeah,
ticks off. Right?
exactly, and we do some education on that.
Right.
But you get a pair of fine tip tweezers, grab the tick at the head as close to the skin
Right.
as you can, and you pull on it until it pops out.
Okay.
In their saliva is an irritant and a cement-like substance that anchors them in. So you have to pull,
Right.
but then it will come out.
Okay. And I've heard, do not squeeze the belly. That's almost like an injector, right? If you do that.
Squeezing the belly is like pressing the middle of a toothpaste tube.
Right.
You're just going to squeeze the bacteria right into your bloodstream. So you are going to make it more likely.
Right.
Because the bacteria is in the gut, and it takes a certain amount of time once it's attached onto you for it to migrate from the gut into its mouth and into your bloodstream. And if you squeeze it, that's why you go towards.
Sometimes a little bit of the mouth parts are left in the skin. I know if you pull it right from the head, I've been told that as long as you get the tick out quickly,
Yeah.
if a little bit of that's left, eventually that'll slough off.
Yeah,
slough
the
off,
head will
so.
come to the surface. It's not
Right.
it's not significant really.
Okay.
If you do your best, and if a little bit's left in, you wait, and the body will push it.
Out anyway,
it up.
like a sliver
Yeah.
or a splinter
Yeah.
or something. So
But and then you watch for signs and symptoms
right.
of disease, always. You know.
Somebody told me circle it with a pen to see if anything develops, just so you know where it was. Is that a good idea, do you think?
You know what's a good idea about
Yeah.
that is because you could start an EM rash, meaning a rash of Lyme disease there, and it's an expanding, disseminating rash.
Okay.
And you want to know if it's bigger today than it was yesterday.
Okay.
And so you take a pen and you mark around the edges of it, and then you look at it, and if the redness has gone beyond that,
Right.
then you know that it's growing. You can do that for any kind of a
Any
rash,
kind
but
of
it's
a
a good, because an EM rash is usually 2 inches or more. And the Lone Star tick, well, all ticks, because they have an irritant in their saliva, will make a red welt that
Okay.
is itchy and can last. But
Right.
that's not an EM rash.
It's not okay. And just very quickly, what do you do with the tick once you remove it? Should you try and identify it, or I know we have people sometimes come to the ER with the tick in a bag. What do you recommend?
I think that it's really good to identify the tick, although regardless of what kind of tick it is, you have to follow that protocol
Right.
of watching for sickness and then going to the doctor if you have it.
Right.
If you identify it as a Lone Star tick, then you know you're not going to get Lyme from that tick. Doesn't
Right.
mean you won't get it from another one.
Right.
If it's a deer tick nymph, you know there's a high probability if it's been on you for a long time. So for that reason, it's a really good idea. Many doctors don't feel they can identify, so they'll just pitch it because they have to do the same protocol
Right.
anyway.
Right. To follow that same protocol. And final remarks. What do you recommend? We all know about the sprays and things, but what do you recommend in terms of protecting ourselves? It's too beautiful an area of the
Yeah.
country to stay indoors all the time. So what do you recommend?
I think it's really important to protect your body. I mean, we want to protect our domains, we want to protect our pets, but I think that things like spraying your shoes with permethrin, which is the chemical that is so good with killing ticks, if you spray your shoes and it lasts for a couple weeks, that will lower your exposure to tick disease by 80%.
It
Just
will.
your shoes. Now you can also have your clothes treated or treat them yourself. But I think it's really good to focus on yourself when you go out there.
Right.
And then beyond that, you can, when you come in from the woods, put your clothes in the dryer. That's a very important thing because the ticks die from desiccation and drying. You put them in the wash and they love that.
Right.
They're going to hang out for a
Right.
little bit longer.
Okay.
Your properties, keep your grass cut short. You can have it treated with either organic or chemical organic doesn't last as long. I mean, you can have those discussions with all the people that
appropriate.
spray. Yeah.
Exactly, and then I
And
think
tick checks, actually, morning and night, both.
Morning and
because
night,
the
really?
ticks crawl from the bottom up.
Oh,
And
really?
you might not see it at night, and it'll be somewhere else in the morning.
Okay. So all good advice, and I know we have a number of other resources on our website as well, and I just would like to thank you, Rebecca, for all the great work you do. And I just would also want to urge anyone who has some follow-up questions, there's probably a lot of things you'd like to ask. Rebecca is available on our tick helpline, and you can see she's obviously very knowledgeable, and if she doesn't have your answer, she'll find the right resource for you. Our tick helpline is at 631-726-TICK, T-I-C-K, so please feel free to call that number. Also feel free to call me at any time in my office at 631-726-8555 if you need help locating any resources, have any questions or concerns, particularly in the summer season when we do see so many tick-borne diseases. I'd like to thank Rebecca Young for being with us and all the great work she's doing here in our community. All of the services of our Tick Center are completely free. We want you to be healthy and enjoying our Hamptons communities. We also would like to thank all of our friends at CTV for producing and airing this show in our Southampton communities, our friends at LTV for airing it in our East Hampton communities. We'd like to thank you for tuning in, and we hope you all have a happy and healthy summer, everyone.